Hello, and how are you? My name is Winnie Barawa, and welcome to our session on roles of school health program team. My apologies, I have a flu, and therefore my voice is a bit hoarse, but I hope you can understand as we engage in this particular lesson. If you're new here, please remember to subscribe, and if you're a returning subscriber, thank you so much. Don't forget to click on the notification button. We've been discussing about school health and the different needs that the school going children have pertaining to health. We've seen at the aims of a school health program, and today we will look at the different members of a school health team and the different roles they play for the particular school health program that they are part of. So the members of the school health team, they are made up of several members and they vary based on the school that people work in. However, the basic structure is just made up of teachers, and this can include tutors, lecturers or professors, administrators, and even the principal. We can also have the pupils themselves. And on the pupil side, we are looking at students and any learner who is part of the school. We have also parents, and parents form mostly membership from the Parent Teachers Association, so they work together through the association. They can also have community formal and informal leaders. So the formal leaders could be example chiefs in the villages, the community, the civil society organizations, or even special groups that work for special populations. Then we have the health professionals. This could be the school health nurse, the public health nursing officer, trained health teachers or trained first aiders, dentists or technicians, social workers, environmental health officers, dietitians and nutritionists, the guidance and counseling office. These are So the first member is the principal or the administrators. What the principal does, mostly they do preparation part, and that is they work together with team members to develop the school health plan or this comprehensive school health plan that will have inputs from the teachers and the students, the families and other members. So this will be the document that they will use to help in enrolling or rolling out the school health program. Then we have integration of health program within the basic operation of the school. So they are the link between implementers of the programs and other members of the community that will help in putting in place the health program in the school. They also help develop procedures to ensure compliance with the school health policies. Remember, the school health program has policies, and therefore the principals work as the executive members in ensuring that all procedures comply with these particular policies without violating any of them. Then the other part is its supervision, that is supervising implementation of the activities, the policies and procedures pertaining to school health. Number five, the principals and administrators ensure that they help in negotiating when it comes to provision for mutual beneficial collaborative arrangement, be it with either agencies, organizations, businesses, or even just community organizations. And for this case, if the principal, for instance, needs partnership with particular agents or partnership with organizations, then the principal becomes the negotiating link between the school and these agencies, and they work together to ensure that the roles and the purpose of the school health are met. The last part is the principal and administrators work together to ensure that they report on the program implementation results and any place that needs to be improved. So the principals are key people because they act as the top-notch executive when it comes and ensuring that the school health program and policies are well implemented to the latter, and that the roles and purpose are actually done according to what was planned in the comprehensive school health plan. So that's about the principal and any administrator in a school. Then the second caliber are the teachers or tutors. So with the teachers, they're mostly pegged with the role of education. And in this case, they can perform personal education, that is areas, for example, of hygiene, personal grooming, personal cleanliness, and all that. Teachers will also participate in doing social education, things that can keep the children safe from issues like drug abuse, proper behavior, and conduct. Then we have nutrition education like eating proper diet, practicing personal health, keeping fit, physical education, and such. And the other part of teachers is they conduct health education in regards to sex and relationship, prevention from drug and substance abuse, and the teachers also will provide the young people with knowledge to help them understand skills and attitude that will later ensure that children can make informed decisions about their lives. So teachers have key role when it comes to personal education, social education, nutrition, physical education and activity, what we commonly know in our schools as PE. They do health education regarding sex and relationships, and the teachers will provide the young people with knowledge, understandings, skills, and attitude to ensure that the children can make informed decisions about their lives. The third group of team members is the pupils or the students. And I would like us to understand that the pupils and students are actually the biggest beneficiaries of this school health team, because all the projects that we do or all the projects that are being implemented in the school, they all target the students or the learners for that purpose. So when the learners come in as part of the school health team, their main role is to act as link between the management and the student. So what the students do is, through the student leaders' help, then the student can come in and helping conduct surveys to fellow students about their health concerns and needs. So it come in more of a state whereby the student can help collect data, or they can help collect information concerning their key areas of concerns and needs that can be channeled to the executive team that can now come in with the school health plans and policies that can help guide implementation of these school health programs. The other part is the students can help host consultations and discussions that can later on increase student engagement to help them promote student participations in their health issues that are relevant to their own lives. So again, through the student councils and student leadership, the students' leadership is able to pull in all the students' participants so that they can get data and information pertaining their health status and needs. And this can not only promote student engagement, but it can also promote student participations in their own lives pertaining. Fourth group are the parents, and parents work closely with the school through the parents associations. And the main role of our parent in the school health program is to enhance good relationships between the school and the community. The parents also act as a formal link of communication on school matters between teachers, parents, and also with the government agencies. The parents can help maintain discipline in school. Remember, discipline and social living is part of child's needs, and they promote partly to the relevance in their health aspects. And for this purpose, parents' participation, is part of maintenance of discipline in the school. The parents also help mobilize other parents to promote enrollment, attendance, and even retention of students or children, both in the school and also in the wards. If you find, maybe you find schools which have clinical placement and such. Then we have provide support for tailored programs. For example, the parents can come in, talk to adolescents about adolescent health and reproductive health. They can come in, provide counseling. The parents can also come in, participate in games and the school activities. So parents are very key, because when children see their own parents participating in the school activities, they normally get excited, they normally get encouraged, and they feel that when they themselves also do the same, then they feel they have greater support and greater assurance that what they are doing is actually right. And the parent also has a role of attending meetings and consultations in helping set the visions for the school. So remember, the school vision is not just the role of the board of managers to do all this, but the parents also have a role to attend these meetings so that they can give their input when it comes to what are their thoughts concerning their children, what are the level of performance indicators they want to see from the school, what are the health needs do they want their children to be more taken care of on. So yes, parents' participation in school activities is very key, and it's part of promotion of school health objectives. And for this part, the main role a parent can come in is establishing good relationships, forming a link of communications, maintaining discipline, mobilization on enrollment and attendance, and providing support for programs. But also, the parent has a role of attending meetings and setting vision for the schools. And the other big participant in here is what we call the partners. So partners can be of different states. We have the international partners and you can have local partners. So local partners or let's start with the international partners first. So the international partners come in as developmental partners, and what they do can be as big as organizations such as World Health Organizations. You can have UNESCO, which is the wing of the United Nations that supports education, and that's what in full we to call it United Nations Educational and Scientific Organization. We have the World Bank. There's USAID, that is United Nations Education, Scientific and Cultural Organizations. And we have the UNICEF, which is mainly Wing for Children Fund. So the partners come in with different roles, but again, you need to appreciate that you can also have local partners, and this is through the local leadership, like the chiefs, village elders, civil society organizations, other specialized groups that have specific functions in the community. Now, when these partners come together and they work with the schools to promote school health programs, they can come in and provide different functions. So what the partners will do, mostly they provide support for the school program. For example, they can provide school health curriculum. You find in schools where maybe their main focus is drug and substance abuse, you may find that the partners can help the school develop a health curriculum that is tailored on eliminating drug abuse in schools. If maybe the target is sexual and reproductive health, you can find partners coming in helping the school set up a curriculum that can foster proper sexual behaviors or informed decisions. So all these are different supports that the partners can give. There's also funding. You find some partners coming and they fund schools with infrastructures. They set up centers for the schools and they even provide volunteers who can just come in and support the schools in ensuring that school health programs are running. There's also system strengthening where the partners come in, capacity build the school, provide with skills and knowledge on how to handle different challenges pertaining school health programs or initiatives. And the partners play all this role together with the school health team members. So what they do is they come in, consult with the school management, get to see the needs of the school, and then in whichever support that the school needs, then the partners normally come in that state. Keeping on, we have the sixth group, which is made up of the health professionals. So this is made up of a wider variety of members and depends on what the school needs. So it can vary from the doctors, nurses, dentists, first aiders, teachers, social workers, counselors, nutritionists, and dietitians. In short, when it comes to health professionals, the team member at that particular time might vary with what the school needs or what the students need to be catered for. So let's start with the first member of the. And so before we handle the members first, we can look generally what the school health professionals do while in schools. So what they do is while in school, they operate in clinics, what we call the school-based clinics, and they can offer any of these comprehensive services. So you can have the key primary healthcare services, which is looking more on treatment and curative services. There's also promoting of positive health behaviors. In the school health clinics, they can provide intentional nursing services, or they can also do prevention of new morbidities, for example, injuries, teenage pregnancies, substance abuse, and so on. So there are key services that the clinics can provide for the students, but they mostly cater for the primary healthcare services. But again, the clinics are supposed to help the health professional look into positive health behaviors, preventing new injuries or morbidities, and you can also look at any other nursing care services that can be needed by the students. So these are just a blanket roles that can be done, but we need to remember that these roles are brought in intensively based on the specialist who's been recruited into the team. So that is why I thought instead of going straight to each and every member of the health profession, let's first check on what are the key services that can be found in the clinics being offered by any of the professional that are from the health part. Okay, so we have the first team member, and that is the school health physicians or a doctor. So not many schools do have this, but in some cases they have an on-call doctor or an on-call physician who most of the time is being sought on at a consultative aspect. Maybe when they need him at any given time or her, they can call and consult for further management. So that's why we are being told the physician or doctor collaborates with other health team members, and that could be any other member of the health team. That could be the nurses, the counselors, or any other fellow doctors that can work with them. So what the doctors do, they number one can consult health screening test and examination on the children. They also guide on the general provision of laws and regulation governing school health. So they come in as an advisor wing for the school when they need to understand general laws and regulation pertaining school health programs. They will also help identify appropriate management of school-related emotional and learning problems. So remember, the spectrum of health disability and challenges in the school can all span from emotional issues to learning disorders. And in this purpose, the doctor can come in to just help in diagnosis and identification of such illnesses. They also help in identifying and managing special needs for children who have handicap cases in the school. They organize emergency plan for schools. With well-established schools, some of them have school ambulances, but in the cases where school doesn't have such facilities, then the doctors can come as an on-call case where they can help organize emergency interventions in case school needs such cases. Then they can recommend safe practices for equipment. For example, with schools that have well-established clubs that involves, for instance, games and sports, the doctor can come in to advise this. Most of the time, though, they work together with the physical therapist and occupational health therapist to come up with better, safer equipments to help the school conduct good sport and game activities. So yeah, he will be part of the team, but doesn't work alone, works with other team members for that case. The second member of the health team is the school health nurses. And with the school health nurses, this team normally works closely with the doctors, and they spend a lot of time with the students. Some of them are based in the school facilities and they work like on a day-to-day basis with the students. So most of the time the nurse is like does a lot of the bulk when it comes to the day-to-day maintenance of the school health programs for most of the schools. And for this purpose, they conduct assessment of the health needs of the students and staff. The nurses can also do diagnosis and treatment of ranges of health conditions, and most of the time they are given this role in accordance with treatment protocols, which is mostly by working together with their supervising physicians. So they also conduct health screening for the students. You find some schools have a privilege of having annual medical checkups for their students. And with this, the nurses have a role of ensuring that the medical list is filled up, the medical checkup forms are updated, and the children files are also good in terms of up to date with their health status and treatment in case a child is on treatment, and management of any comorbidity or illnesses that the child has. Then the nurse also does health promotion and disease prevention activity, and that is maybe host health awareness weeks, or sometimes they host health clubs in the schools, and they sit together with the students on particular days of a week, and they discuss different illnesses, prevention activity, treatment, and best approaches to handle themselves as children in terms of prevention from such cases. Additionally, the nurse works with the school to individually just provide health education and counseling for the children. They also provide first aid and emergency care for these kids. The nurse also has a role of ensuring that they provide continuous care services for children who have disabilities in the school. They monitor also immunization status for the children. They administer any key medication that the child is not able to self-medicate or self-administer. And then there are instances where maybe a child has a chronic illness and needs necessary referrals. Then the nurse can provide assistance to its families in ensuring that they are visiting appropriate healthcare providers. So, like I said, the nurse is the one mostly who spends a lot of time with these children, and he or she does majority of the roles that pertains to the school health cases. And for this case, it can vary from assessment, diagnosis and treatment, screening, promotion, education, emergency care, taking care of the children with disabilities, monitoring immunization status, medication, and even referral systems. So if you look at all this chain of roles, it all entails a lot of work that surrounds the children. So you need to give it a thumb up for the nurses who work in these schools. The other caliber is the school counselor or psychologist. For psychologists, the main role is concerned with emotional health and well-being of the children. So they look onto how to express feelings, help the child build some confidence, get some emotional strength, as well as supporting their emotional health. So what the counselors do, they more work on promoting positive emotional health and well-being for the children by conducting counseling sessions. We need to appreciate that being in school means children are many and they come from different family background. And from this background, the children can be exposed to different risks, and some of these risks could actually be an effect on the emotional health of the child or the psychological state of these children. Now, for a child to perform in class, for a child to have good performance indicators or to have good scores, then you need a mentally stable child. So most of the time when cases of a child who is in school and is disturbed, not settled, and they are not knowing what to do, then there's the need of intervention for the counselors or psychologists who come in more on a consulting base, and so they conduct the counseling sessions for these children. In some cases, they could be doing individual counseling sessions, but other cases, the counselors actually pull in the group therapy sessions together with their children, with their parents, so that they can have a wider view of how the situation can be solved. But again, it's very important to know that for us to have an easy way with the counselors, the teachers have a bigger role also to play here, because they are the ones who spend majority of the time with these children in classes, and so they're able to pick up signs and symptoms of children who have a mental disturbed state or children who are not stable psychologically, either by looking at their performance or looking at their behaviors or checking on how they interact with other children. And so you can easily pick children who seem to be disturbed, and so can now refer that case to the counselor or to the psychologist on the basis of the needs of the child. And the team that next can be part of the school health management is team of medics who provide specialized services for children with special needs. And this can include several types of specialists. So you can have the physiotherapist, and what the physiotherapist does, his main role is to emphasize more on compensation for the children who have mobility, gait, strength, and postural deficit. So they come in with issues of mediation, exercise, providing management for children who have more musculoskeletal challenges or deficits. But again, you can have the occupational therapist who also focuses more on children who have self-care deficit. So they'll take care of these children, but their main focus is ensuring independence in terms of taking care of themselves, meeting the day-to-day needs. For example, eating on their own, cleaning on their own, being able to attend to themselves without the need of an assistance. So for this case, the occupational therapist, apart from focusing on movement and mobility, their main goal is to ensure that the child can attain self-care abilities where they can take care of themselves. They can change position from one side to another without the need of a helper or without the need of an assistant. And the other specialists who can be part of the team of the school health team, then you can have speech, language, and hearing therapist. So the language therapist, what they do, they provide special education services closely with the teachers and parents, but the main target is to help children overcome communication problems. So um, appreciating that some children may actually have learning disabilities, and for some of them, the learning disabilities or problems is actually due to communication limitations. And there are students who have delayed milestones when it comes to speech. For this case, the language therapist comes to help them overcome such issues. And so, with parents being part of it, the parent come in as a motivator. The teacher being part of this also comes in as the key implementer for most of these cases, because they're the ones who conduct the lessons and the ones who prepare the learning plans. So for that purpose, they're able to both work collaboratively to pull in a common approach into helping the student. Then lastly, we have the audiologist. So the audiologists, these are certified professions who have specialized in hearing in hearing disorders. So their main purpose is to come, identify, and then manage children with hearing impairments in the school setting. So they come in maybe with hearing aids, or they help the student improve on best ways on how to uh, handle sounds and understand how sounds means and all these aspects. So audiologists are mainly specialized with sounds, but the main purpose is to help children with hearing impairment in the school settings. All right, so let's move with the school health worker. So what are the school health worker? So the school health worker is simply a link between the home, the school, and the community. So the school health worker works together with the parents, works together with the community, works together with the school. They also work together with other social agencies in the community or even governmental related aspects to just ensure that the child has maximum focus in school. So the main function of the school health worker, sometimes they say it gets confused with the counselor and psychologist, but there's a demarcation between these two. So what the school health worker comes in, he comes in as a support system for the children. So what the school health worker will do is he will support groups for students and parents where in cases where there's a crisis case of conflict and there's need for reconciliation, then the social worker can provide support groups for both students and parents. The social worker also provides crisis prevention and interventions. We've seen cases where a child is being raised by drug addict parent or parents who have a problem with drug addiction and management. And the social worker comes in to bridge that gap. They also help refer the child to the proper children departments for them to be helped. There's also a purpose where they do home visits in case a child is severely affected by the social environment at home. Then they come in and just ensure there's home visiting, establishing the safety of the child, establishing the care needs that needs to be met for this child. There's also need for social developmental assessments. This is where comes in with the home visit. They do the home visit, establish parental care, parental management, if the parents are actually present or absent, and how best the child can be helped. Other moments, they can do parent education and training. They can request for parents meeting in schools, and they create awareness to the parents or advocate for proper parenting and social environment for the children so that they can have maximum social development. There's also case management cases. For instance, if they realize that a child has been affected by the behavior of a parent, maybe a parent is a drug addict, or a parent is severely affected by maybe job loss. So they can actually provide case management, referring them to children department, legal systems, or even social or referrals that can help the child stabilize. Then there's information and referral, and the social worker also collaborates with other pupil services personnel and with other community agencies. So like the way I was explaining that the social worker is a link. So it can work with any agency in the community that he or she knows can help ensure that the child is safe in the school. So they can work with other services, could be lawyers, gender department or children department, and they ensure that the child services are met. They also advocate for children, parents, and the school system. So we found cases maybe where a school has been affected by certain issues and the school is not able to meet the optimum environment or the optimum proper health promoting environment. And so the social worker can advocate for this school, they can meet the legal system, they can meet the social system to just stand in the gap and present the school to these particular agencies as complaint. Then there's school staff development and policy development. So they can check on discipline cases, attendance policies, how the school is interacting with the students. Remember, we said for a school to ensure that there's maximum advantage to the child, then the school needs to be healthy enough for this child. But in cases where the school is actually a risk to the child, then the social worker has a role to ensure that the school has been empowered enough and the school has had good staff development and policies that ensures that it is child friendly, it is child safe, and it has health promoting aspect. So the social worker has a huge role. Apart from working with all the team members in the school health program, they become more of like the roots that ensures that the school health program meets its aims. They do not allow meandering from the original idea of how to handle the school program. So they ensure that everything is done properly and they are the link between the school, home, and even the community agencies. All right, and the other group is called nutritionist or dietitian. So nutritionists and dietitians, the main role is to work on the nutrition needs and diet of the school. So what the nutritionists and dietitians can do is provide education activities. So they can provide like reading manuals on the best nutritional activities for the children. They can create education sessions for the children, creating awareness on healthy eating, healthy diets, balanced diets, or diet diversifications and choices that can promote healthy living and healthy eating for the children. They conduct nutritional screening, assessment, and referrals. Remember, it's also in school that children can be at risk for complications like malnutrition, which could either be overnutrition or undernutrition. And under the overnutrition case, we could have cases of obesity. But again, on the case of undernutrition, then you can have cases of marasmus, kwashiorkor, rickets, and so on. So the nutritionist can come do all these screenings, assess the children, find their nutritional status, and then give any needed referral in case they find a case that need clinical interventions. The nutritionist can work together with the school on menu preparations. They can also provide manuals and recipes on how to prepare this man of meals so that the children do not get maybe under prepared meals or overcooked meals. So remember, as much as the diet has to be balanced, we also need to have food that needs to be properly prepared or adequately prepared, observing not only hygiene practices but also ensuring that they provide food that has been stored on the right temperatures and has been stored also in safe environment that is free from toxins. And the other part is coordinating feeding programs. We have schools that have put children on feeding programs, and maybe they require the children to pay a particular amount of money or contributions to cater for these meal plans. So for this purpose, it's the nutritionist or the dietitians who has the role of follow-up on this feeding program, ensuring that each and every child gets their required amount of food or gets their needed portion. And so they become the main person who is in contact when it comes to providing reports pertaining the meals and the feeds that the children should get. And so lastly, if you need more links on how to read on the team members of the health programs, you can refer to this. And so my name is Winnie Barawa. Don't forget to give us a comment. If you're a new subscriber, I repeat, don't forget to subscribe. Until we meet again, see you and bye bye.